Hey guys, it's Crystal from livingwithgastroparesis.com and it's FAQ Friday. So this week I put out a call on my Facebook page and I asked you guys what you wanted to talk about for FAQ Friday. I got a ton of responses, so thank you for that, and rest assured that we will be talking about many of those topics in the weeks to come. This week I want to talk about something that got a lot of attention, and that was bloating, and specifically bacterial overgrowth. So I'm going to talk a little bit about bloating as it relates to gastroparesis, and then we'll dive in and we'll talk specifically about the bacterial overgrowth and understand what that means and how that happens and how we can get it diagnosed and treated. So, as I'm sure many of you know, bloating is very common among people with gastroparesis. There was actually a study published in last month's American Journal of Gastroenterology that looked at bloating specifically related to gastroparesis. And not surprisingly, they found that I think it was 76% of the people in the study reported having somewhere from mild to severe bloating. And what was interesting, though, was that they found that it didn't really relate to the degree of gastric emptying. So the gastric emptying rates didn't predict whether someone had bloating or how severe the bloating was. So if it's not the gastric emptying per se that's causing these symptoms, what is it? One possibility is small bowel bacterial overgrowth, and you might actually hear that called small intestinal bacterial overgrowth. So SBBO or SIBO, it's the same thing. Basically, most of the bacteria in our GI tract is supposed to be in our colon. The colon has a large number of bacteria, it has a variety of different kinds of bacteria, and it's supposed to. That's needed for proper digestion. When your small intestine starts to resemble your large intestine in terms of the number and the kinds of bacteria, that's when we have trouble, because your small intestine is not supposed to have nearly as much bacteria as found as the large intestine. So when the bacteria overgrow, bacterial overgrowth, right? So when too many bacteria are growing in the small intestine, it can cause bloating, belching, pain, some of the same symptoms as gastroparesis: fullness, nausea, vomiting, weight loss. And so the symptoms of gastroparesis and bacterial overgrowth definitely overlap. There have only been a handful of studies that really look at bacterial overgrowth specifically related to gastroparesis, and specifically in gastroparesis patients. And those studies have shown anywhere from 20% to over 60% of the people with gastroparesis are dealing with bacterial overgrowth. So between 20 and 60% of us are likely to have an issue with this. I think it's probably closer to the 60%. Those studies used different testing methods, which we'll talk about in a minute, but certainly a significant percentage of those of us with gastroparesis are also likely to have a problem with bacterial overgrowth in our small intestine. And one of those studies actually related it to the length of time that people had gastroparesis. So the longer you've had gastroparesis, the more likely the people in the study were to have bacterial overgrowth. And let's talk about a couple of reasons, a couple of things that predispose those of us with gastroparesis to bacterial overgrowth. So first of all, there's the dysmotility. Food is supposed to move through the GI tract. You know, the contractions of the GI tract all the way from the stomach to the small intestine to the colon are supposed to move food down, and they also move bacteria down. When things are not moving, the bacteria can kind of grow backwards. So the bacteria that's supposed to be in your colon, it can grow backwards into your small intestine where it's not supposed to be. So constipation, if you're chronically constipated, that's another issue that can relate to small bowel bacterial overgrowth, because that bacteria comes from the colon up into the small intestine. Another thing is acid-reducing medications. So stomach acid, part of its job is to kill that bacteria before it goes into the small intestine. So when we don't have enough stomach acid, we allow that bacteria to grow and to be emptied into the small intestine. And so A lot of gastroparesis patients are on either proton pump inhibitors or other kind of acid-reducing medications for a long period of time. And so that combined with the dysmotility can certainly set you up for bacterial overgrowth in the small intestine. I mentioned bloating, I mentioned belching. Some other symptoms include, I said fullness, right? Nausea and vomiting, things that really overlap with gastroparesis a lot of the time. So it can be difficult to tease them apart and find out exactly what's going on. But other things like weight loss, sometimes malnutrition and malabsorption of nutrients, because the bacteria actually eat the nutrients in the small intestine before your body can absorb them. And so you can be deficient in nutrients because of the bacteria overgrowing in the small intestine. So it can become a pretty severe nutritional issue if it's not treated and if it's a severe case, in addition to causing the symptoms that we mentioned. And when we talk about bloating, we're talking about pretty severe bloating in a lot of cases. So people will describe it as, looking 5 or 6 months pregnant. And it's really because of the bacterial overgrowth. And when the bacteria eat those nutrients, they release large amounts of gas. And so that's what bloats up the stomach. That's what's caused the belching. It causes stomach pain. It can cause cramping and gas. So not pleasant symptoms. How do we get this diagnosed and how do we treat it? Well, diagnosis, the most accurate way is via a biopsy that's done through an upper endoscopy. And my understanding is that this isn't very common. It's not done very often, but it's the most accurate way to find out whether or not there are excess bacteria in the small intestine and to see whether or not they're doing damage to the small intestine. Non-invasive ways of testing include breath tests. So there's a few different breath tests that can be done. One is a hydrogen breath test, so you'll drink a solution and then you'll wait a while and they'll test to see how much hydrogen is in your breath. The bacteria give off hydrogen, so they can tell whether or not there's bacteria overgrowth that way. The test is, it can give false positives, it can give false negatives. It's not nearly as accurate as the biopsy, but it is non-invasive, and it can give you an idea of whether or not that might be a problem. As far as treatment goes, it's usually treated with an antibiotic. I think rifaximin is right now the most commonly used antibiotic for this, but there are certainly a wide variety. Sometimes a doctor will just give you an antibiotic based on your symptoms because it kind of sounds like you probably have bacterial overgrowth. That's not a really good diagnostic tool because some people won't respond to the antibiotic, and that doesn't mean that they don't have bacterial overgrowth. On the flip side, it might make your symptoms better, but that doesn't guarantee it was because of bacterial overgrowth. So a lot of doctors will do that just thinking it's worth a try to see if it helps you, but it doesn't necessarily rule in or rule out that that's exactly what's going on. In addition to the antibiotic, obviously managing constipation and getting the colon to empty as regularly as possible can prevent the bacteria from moving back into the small intestine. Managing your gastroparesis as well as possible. Also avoiding too much excess sugar and sweets in the diet because those can certainly contribute to the bloating. And trying to normalize the acid in the stomach. Which I know for those of you who have severe acid reflux, that can kind of put you between a rock and a hard place. But there are many, many people who are just put on acid reflux medication before they were diagnosed with gastroparesis, and that hasn't necessarily been reevaluated since the diagnosis has been made. So not everybody who has gastroparesis needs to be on a proton pump inhibitor. So that's just something to talk about with your doctor and maybe reevaluate that. So hopefully this was helpful and you have a little bit better understanding of what bacterial overgrowth means, how you can be tested for it, and how it's treated. It gives you some information to take with you to your doctor and ask some questions specific to your experiences. Head on over to my Facebook page at facebook.com/livingwithgastroparesis and join the conversation about this. And you can also sign up for my mailing list there, and you can get my monthly newsletter, and you'll also be notified when my new book, Living Well with Gastroparesis, is released within the next month or so. And I will see you next week for another FAQ Friday.